Human diseases caused by virus. First one is AIDS, acquired immune deficiency syndrome. It is a disease caused by the HIV virus. In this condition, a person's immune system becomes too weak to fight any kind of infection or disease. It is usually the last stage of HIV infection, and when untreated, it leads to death. Someone with AIDS may develop a wide range of health conditions like pneumonia, thrush, etc. There is also an increased risk of developing a medical illness like cancer and brain illnesses. Mode of transmission of AIDS is mainly of four types: through unprotected sex with the infected person, through sharing needles and syringes with the infected person, through the mother to her womb, through the transfusion of blood from an infected person. Next, the symptoms of AIDS. Symptoms are fever, muscle and joint pain, headaches, sore throat, night sweat, red rashes, mouth sores, tiredness, swollen lymph glands, weakness, weight loss, diarrhea, etc. The late stage of HIV infection includes blurred vision, persistent or chronic diarrhea, dry cough, fever of above 37 degrees centigrade, night sweats, permanent tiredness, shortness of breath, swollen glands lasting for weeks, weight loss, and white spots on the tongue or mouth. Prevention and control. AIDS can be prevented if healthy individuals refrain from having sexual contact with AIDS infected individuals. It can also be prevented by using condoms during sexual intercourse. Checking blood for infection before using it for transfusion can also prevent the spread of AIDS. Its spread can also be prevented by using disposable syringes. There is no specific or perfect cure for AIDS, but with proper diagnosis, treatment, and support, one can fight it and live in a relatively healthy and happy life. One needs to take treatment correctly and deal with any possible side effects. Medicines are used to stop the virus from multiplying. One major treatment for AIDS is ART, antiretroviral therapy. Next disease is rabies. It is spread through the animal bite, such as dog, and it is caused by the infection of rabies virus. The infection caused by this leads to encephalomyelitis, that is the inflammation of brain as well as the spinal cord. The transmission of virus happens through the saliva and affects the central nervous system. This virus belongs to a family called Rhabdoviridae. It takes the shape of a bullet. Mode of transmission of rabies. The dog which is affected by rabies transmit the disease to the human through the saliva. This enters into the tissues of human body and starts to multiply. After it has affected the tissues, the virus travels to the central nervous system through the spinal cord. Then it reaches the brain and causes serious brain disorders called encephalitis. There are chances of it causing the death of the person. The disease has an incubation period of about 3 to 12 weeks. Symptoms include frequent headache, nausea, stomachache, muscle cramps, drowsiness, insomnia, severe fever, anxiety, hallucination, difficulty in swallowing, etc. Prevention and control includes get rabies vaccination to prevent the infection, vaccinating your pet against the disease, maintain distance with the wild animals, wash wounds with the soap and water and maintain good hygiene, keep your pets away from other stray dogs, prevent bats wandering around your campuses and living places. Treatment. Post exposure prophylaxis consists of a dose of human rabies immunoglobulin and rabies vaccine given on the day of the rabies exposure, and then a dose of vaccine given again on days 3, 7, and 14. People who have been previously vaccinated or are receiving pre exposure vaccination for rabies should receive only vaccine. Third disease is measles. It is also known as rubeola or red measles. It is a highly contagious respiratory infection caused by measles virus which causes rashes all over the body. Measles could be spread through infected mucus and saliva. Incubation period is usually 10 to 21 days. Main symptoms include bright red complex spot. Transmission. When the measles infected person sneezes or cough, the virus is released into the air. Measles virus could travel through the air, so anyone in that proximity might be infected by that virus. Symptoms generally appear within 14 days of exposure to the virus. General symptoms of measles are body rash. Body rash appears within 4 to 5 days after the symptoms start. It might be accompanied by high fever, hacking cough, red eyes, muscle pains, running nose, sore throat, sores inside the mouth, etc. are other symptoms. Prevention and control. As there is no specific treatment, it is advised to follow all necessary precautions which help to prevent measles. Children should be vaccinated within 12 months of their birth, and the second dose should be between the ages of 4 and 6. MMR is a vaccine that prevents three diseases like mumps, measles, and rubella. Treating the disease in early stages is also very important, especially for children. Medications that help to improve the immune system, medications to reduce a cough and sore throat, acetaminophen to reduce muscle pains and fever, foods that are rich in vitamin A, hydration, bed rest, administration of antipyretic agents are included in the treatment section. Next is swine flu. Swine flu is an infection caused by type A influenza virus. It's called swine flu because it's similar to a flu virus that affects pigs. The virus leads to lung disease in pigs, and it is a respiratory infection in humans. Transmission. A virus causes swine flu spread from person to person. When a person coughs or sneezes, droplets go into the air. You can get the infection when you breathe in the virus. You can also get the infection when you touch a contaminated surface and then touch your mouth, nose, or eyes. You can't get H1N1 by eating pork. Symptoms may start 3 to 5 days after exposure to the virus. They are fever, chills, cough, sore throat, body or muscle aches, headache, fatigue, etc. Prevention and control. The best way to prevent swine flu is to get your annual flu vaccine. Cover your nose and mouth with a tissue when you sneeze or cough. Wash your hands with soap and water. Stay home if you are sick. Don't share personal items such as cups, straws, and utensils. Treatment. Get plenty of rest, drink fluids, eat a light diet, stay home, take acetaminophen to reduce fever and relieve aches and pains. That's all. Thank you.